Hi, everyone. My name is Dr. Michael Wald, and I am so excited to speak with all of you today about how to interpret laboratory work. So those of you that have listened to my show before, Ask the Blood Detective, know that the style of my presentation is that I give you everything. I don't hold back on the details that much at all. In other words, I present to you what I might present to healthcare providers at an actual medical or nutritional symposium, because I feel if I cut corners with you, if I give you wrong explanations or simplified explanations, which doctors are famous for doing with their patients, it almost always leads to misunderstanding because it's not accurate. So if I give you information and say to you, for example, well, diet can change your pH. You might think that diet can change your pH. Diet can change your pH, but it will change saliva pH and urine pH. And those sorts of pHs are changed with this simple maneuvers like jumping up and down or feeling stressed, and of course, eating different foods. But blood pH is not affected very easily at all, and not at all by a single meal, for example, unless you're a diabetic that is particularly a brittle diabetic or someone that's really advanced with disease. My point here is that we want to say, well, listen, if pH is useful for something, then what is it useful for? It's useful for blood work, giving goals, and it's useful, let's say, for urine if you want to assess the urine for, is the pH, for example, too high, which lends itself to urinary tract infections. So once again, I'm trying to relay to you that specific testing may have a certain kind of accuracy and application depending on what health problem. So there's no one test that's good for everything. Now, by the end of this very ambitious presentation, you're going to learn quite a lot about nutrition and how doctors interpret nutrition, both through traditional medical means and medical education, and also through advanced nutritional training. So let's move on to our first slide. But before I do, let me give you my contact information so you can send me your comments, questions, and ideas for future presentations. But keep in mind, you're taking course number 2 in my 13 one-hour session Masters in Nutrition presentation. Each of these courses stand alone, so you can just pop in on any course as you'd like. But I encourage you to listen to the first presentation on healthy diet basics in case you missed that, so that you have all the information that you have. You'll simply get more out of it if you come to all of the talks. What's nice is that they're archived as well, and you can see them on my website at drmichaelwald.com under the blog section, and you can email me at info@blooddetective.com. My phone number, in case any of you want to work with me regarding your health, is 914-552-1442. Okay, so let's get to it. So just a real quick review of my credentials, because credentials are important. Do they say everything about a practitioner's qualifications and skills? Of course they don't. But if you're not at least starting with someone who has specific certifications and diplomas, you really cannot rely on their education and or its accuracy. So I first attended chiropractic college. I graduated in 1990. My father was a chiropractor, which makes me a second-generation chiropractor. He was also a nutritionist. And I spent many, many years around him, and he really fortified my love for holistic health and nutrition, and of course, chiropractic. And after chiropractic school, I actually got my master's in human nutrition degree from the University of Bridgeport. And then after that, I went to medical school and earned my MD diploma. I have a nutritional degree in nutrition philosophy, and also I'm a sports nutritionist. And in the state of New York, the 2 most common designations for qualified nutritionists include the certified dietitian nutritionist and the certified nutrition specialist degrees, both of which I have. I am licensed to practice acupuncture in certain states. I got my personal training certification, so I really knew how to instruct people on exercises, sometimes even work out with them, whatever it takes. And I am double board certified in nutrition. So you're going to be hard pressed to find someone with these qualifications, but depending upon your health concerns, you may not need someone with all of these. But the point is, education is different. You don't simply want someone with some weekend nutrition course. I think you get the point. Now, as we move on with the labs, I want you to take a look at this picture. For those of you who are watching the PowerPoint Zoom presentation, and for those of you who are not, we're looking at a slide which is black and white, which shows a bunch of circles, which are red blood cells. And the circles are with a white color, and then everything else is black. It looks like the universe. And then there's some circles in here that are filled in with white. Those are white blood cells. And the ones that are not filled in, and they're clearer for the most part, are red blood cells. By looking at the laboratory work under a microscope, there's so much we can see about nutrition. We'll talk about that really soon. But laboratory work is like, it's like a universe, because when I look at someone's blood under a microscope, there is so much to see. And then when I compare their laboratory work from a piece of paper, for example, and I put this all together with consultation and questionnaires and looking at health goals, you know, if you don't know where you're going, how do you get there? How do you set up a plan of success, a health plan that is successful? You need to have specific measurable goals. But this universe of information is now going to be available to you, particularly those of you who complete every single one of these courses. So if you have questions or concerns about anything I talk about, you please let me know, and I will do my best to clarify for you. So with this universe of information, it's up to the healthcare provider to put this information to the test and relate it to the individual person, the individual patient in front of him or her. So men and women with different symptoms, with the very same blood work, it might mean something differently in context. If that's confusing, not to worry, it should be a little bit. This is relatively new to you, so just hang in there. This is another picture of neutrophil cells. These are round cells, and inside you see these sort of circles that are connected. And again, we can tell by the speed of a neutrophil, which is a type of white blood cell, about immune resiliency. And then there's specific nutritional connections to that. Now, before we move on, though, let me also give you a disclaimer that all of the information I'm presenting to you today is for your education. It clearly is not based upon your needs, so I cannot say to you, use all this information and good luck with you. It is educational information only, and it's not to be used to replace sound medical or nutritional health advice. Now, this slide is entitled, "Blood testing is not what you think." Now, what does that mean? Well, let's look at the bullets. There's health perspective versus disease perspective. The individual practitioner who's reading laboratory work, if he or she has a mindset of looking for a disease, then that doctor is going to look at your labs for very clear abnormalities, which almost every other practitioner in that same field would say, yes, this is disease. But if you have a mindset of disease, but also you have a mindset of health, and the concept of dis-ease as opposed to disease, we have health on this end of the spectrum, we have death or disease on this end of the spectrum, and then we have gradations or a spectrum of disease here as well. And this dis-ease part leading to disease, this is most of it, and physicians really don't know what to do with themselves here because they're only trained in the end game here of disease. So it's like looking at a piece of art. If you have some background in art education and appreciation, and you look at a piece of art, you might look at that art and point out some very wonderful details that you see clearly before your eyes that another person with intelligence but no background in, let's say, art, history, and education would not see. So because I have a very rich educational background, I bring that perspective and that filter to what I'm looking at, whether it's the patient, lab tests, or considering things. So we want the broadest perspective that we can have. What is the purpose of blood testing? Well, obviously, so you can find out if you have any problems. So many people come to me and they say, Dr. Wald, I've had all these symptoms for so many years. My doctor has done all these laboratory tests. They've done everything in the world. The doctor is wonderful. Everyone knows him. And I don't know what to do. I rarely am impressed with who the doctors are. I just want to know, do they do a good job at figuring out what your needs are? Now, number one, error in thinking is that to think that your doctor has done every test that you need. Oftentimes I find that's not true. Secondly, if you're told that your labs are normal, that might also be a serious error in assumption, because many times I have patients come in and they thought their labs were normal. They hand me their lab tests and it's clear that the labs are not normal. And generally speaking, doctors might have missed these abnormalities because in their minds, they don't add up. The puzzle pieces don't connect very well to show a disease state. or an obvious abnormality. So doctors shrug their heads and they don't look at it. Now, sometimes also, if you're being told that your laboratory work is normal, let's say by a medical office, you call them up or you visit the office, sometimes you're given that information from a physician assistant or a nurse practitioner or some other practitioner. And I'm not saying that these practitioners do not have skill and education in laboratory work. They absolutely do. But I do not find that it is up to par with physicians who really know lab work. It's just based on my 30 plus years of experience. So you want to make sure that a qualified person is reading your labs. Let's look at the third bullet, problems with blood interpretation. Well, that goes along with what I'm saying. You'd think that if you have numbers of lab tests on a piece of paper, that anyone reading that piece of paper would come to the same conclusions. Well, that's as irrational as someone thinking that everyone has the same politics. Need I say more? Or can look at the same data and think it means the same. So different perspectives, different education has to do with how laboratory work is interpreted. And then there's the fourth bullet on how blood ranges are determined. Now I'm talking about ranges now. So for example, we're going to talk about a little bit over 10 different examples of blood tests that, like, for example, like cholesterol that has a range, what's called a clinical range or a normal range on a physical blood test, let's say of 0 to 200. Now, would you think that someone has the same cardiovascular risk if they have a cholesterol of, let's say, 185 compared to someone with a 195? Obviously, the higher your cholesterol, the greater your risk of cardiovascular disease. This is generally recognized in every branch of medicine. But both 185 and 195 are normal, you see. So these are problems with the ranges on tests. So I'm going to ask you a question. Do you know? Can you imagine where those normal ranges for glucose and cholesterol and mercury and cadmium and estrogens and testosterone and growth hormone, all that stuff on a blood test, where those ranges came from? How were they determined? Well, you might be surprised to learn that a lot of those ranges were based upon national averages of people donating blood that are seemingly well. So let's say you're having a good day and your blood work looks fine. You go donate blood, but for all you know, you could have brain cancer or fibromyalgia or some chronic virus, but the labs may be normal. And then you contribute your blood into the national database and they do all of those tests. And then they do that with a whole bunch of other people, maybe hundreds, possibly thousands, sometimes less. And then averages are determined and you are compared to those averages. Those averages have nothing to do with, or very little to do with, healthy ranges. We'll distinguish healthy and average ranges in a bit. But I want you to know that as part of my blood detective software program, which I invented, I've researched for decades now what optimal blood ranges are and what average blood ranges are. So what may be a normal blood test when you're compared to the average, maybe an average result of that test compared to healthy people. If I compare you to healthy people, you will have more abnormalities than if I compare you to other men or women in your age group. But when I compare you to something better, usually an entirely different nutritional story is right there before your eyes, which gives many answers that you did not see before with the very same results on a test. And our last bullet here, blood interpretation from a medical versus nutritional perspective. Again, if your doctor has little or no nutrition education and looks at blood tests, you're not going to be given nutritional advice. But if your practitioner knows, for example, that high cholesterol might mean you need more niacin, vitamin B3, or vitamin E or fiber, let's say, then you'll be recommended that. So don't be too confused if your doctors say to you that nutrition is useless or next to useless and watch your diet as if that means anything. You know, let me watch my diet. We need details here. So let's get on to that and we will see what I mean by details. So you're looking at a picture here, for those of you looking at the PowerPoint presentation, of what looks like an oval circle here, a more oval shape with some things inside of it, a bunch of mishmash. That's a white blood cell. And again, when certain doctors look under the microscope, they can see how cells move around and if they are properly shaped, any physical or visual abnormalities. That's called assessing morphology. But you can't do that when you just look at numbers on the test. So for example, if your red blood cell count is normal, but I look at your red blood cells under a microscope and your red blood cells are very, very large, the largeness may not show up on the regular blood test until it's extremely advanced. So that's why looking under the microscope is sort of like considering what's under the water of an iceberg. The smallest bit is at the top, and most of the iceberg is underneath. So it's important to always compare blood work under a microscope to blood work that's run through a machine, which is the type of laboratory work that you're familiar with from your regular doctor's office. So disease, dis-ease, and health, that spectrum we just spoke about. Well, again, sometimes you'll be told that your lab tests are normal. That shouldn't mean so much to you. That only means you're normal compared to other people your age, and maybe the people your age on average are not that healthy. Then again, I mentioned the blood detective technology. It's got over 20 years of data in it, and then I overread reports generated from it once I tell the system what your abnormal laboratory tests are and your normal laboratory tests. And this concept of clinical ranges versus healthy ranges. Clinical ranges are normal ranges. They're the ones that you're familiar with on your blood test. As I mentioned, cholesterol range, estrogen range, that's all the clinical stuff. And then healthy ranges are differently placed newer normals or optimal health normals that can get you much healthier if you use those as a guideline. And usually the way I do it is in context with the regular clinical ranges. So I read blood tests and other laboratory tests as any medical physician would, and I also read it nutritionally. It just simply brings more to the table. Regular dietitians and other nutritionists that do not have doctorates are not trained, nor should they be interpreting blood tests and other types of laboratory tests of any type. That's just not what's in their scope of practice, and it's not in their education. There's a lot of that going on. And then I put here a little statistic that there's little or no nutrition training in medical schools. The national average, the last time I checked, was 27 hours of nutrition training in 4 years of medical school. And generally, it usually extends out much longer than that. So you want to find a qualified healthcare provider that has the proper training. So let's talk about vitamins and minerals in the serum. Now, the thing about vitamins and minerals in the serum is that the serum is just telling you the levels of a vitamin or mineral over the last maybe 2 to 4 days, somewhere in that average. I put 2 to 3 days here. So patients will say, Dr. Wald, I want to have every vitamin test we can do. I'm curious about my vitamin levels. It doesn't work that way for the most part. For example, if we check vitamin B1, 2, or 3, or B6 in the blood plasma, that will only tell you the last 2 to 3 days. And that's not particularly valuable. I mean, there are times where you do want to know the immediate level of a vitamin, but let's not misinterpret that into meaning that it has anything to do with your long-term need for that vitamin. There are other tests, some of which we'll talk about, which do have some utility. For example, I'll give you one example right now, vitamin D. Vitamin D, being a fat-soluble vitamin, we know is a very good marker of whether or not we need vitamin D or not, and or have we either eaten enough vitamin D containing foods or exposed ourselves to enough sun so that the body can produce vitamin D3 from cholesterol. So let's go down these bullets. So again, the vitamin and mineral levels for the most part just test only recent intake, the last 2 or 3 days. And so if I were to test, let's say, your red blood cell level of, let's say, magnesium, since a red blood cell lives an average of 120 days, if you're low in magnesium based on that test, I know that you're low in magnesium for at least 4 months. And since magnesium is required for over 500 different enzyme reactions, and enzymes run everything in the body from repair to degeneration, that's important. But a serum or plasma magnesium, really no use. There's lots of examples of that. And if I wanted to know how well you're using a vitamin, which is different than a level of a vitamin, is, for example, if I want to know if you're using your folic acid normally, your blood levels, your serum or plasma levels could be quite normal. They could even be high. But if your red blood cell is large and you didn't have cancer or don't have cancer and your cholesterol is less than 300, which those two things can cause red blood cells, but you've ruled them out, then that large red blood cell may be because you're not using your folic acid normally, and also your B12, B6, vitamin C, E, and B1, roughly in that order, just based on the size of a cell. but that is a functional test. You're seeing something actually moving with your blood test. So there's lots of examples of those that go beyond this conversation in terms of functional laboratory tests. And what else can I mention on this slide that is useful for you? Well, the last bullet is important, and we're going to review this in a few minutes in more detail. Not all nutritional tests mean that you have a health problem that is primarily nutritional, and that by normalizing that abnormal vitamin or mineral test, that your problem will go away. So in other words, you might have had or have, let's say, a folic acid deficiency, and but that folic acid deficiency might be from an increased need of the, let's say, your intestinal tract to make new cells because the old cells are becoming cancerous. So your body hyperutilizes nutrition in many respects when you are particularly athletic, during pregnancy, and also during many different types of diseases, or you're repairing or managing any health problem. Let's go to the next slide. And this slide is very, very important. These are a couple of examples of some common nutritional considerations of nutrient tests and how many lab tests, many blood tests are not vitamin and mineral tests. They're tests of other products in the body that tell you indirectly about nutritional need. Let's look at cholesterol. Now, cholesterol itself is an antioxidant, folks. That means it's an anti-inflammatory. So when you have inflammation in your body, let's say in your blood vessels, your body makes cholesterol, it attaches it to a blood vessel wall to try to reduce the inflammation or oxidative stress. So cholesterol initially responds favorably to increased oxidation, which will harden up arteries, causing atherosclerosis. So if we're going to lower cholesterol, we don't want to lower it so low that we don't have enough cholesterol so the body can actually repair. But look at the first bullet here. Cholesterol, when it is high, the H after cholesterol here in the bracket means high. If we have high cholesterol, the person usually will benefit from vitamin E, coenzyme Q10, niacin, which is B3, fish oil, and fiber. I could name many other potential nutritional considerations. So when I look at a blood test, I'm comparing each and every laboratory test practically to the known nutritional associations with it. And when you put all that together, then you come up with a personalized plan for an individual in terms of nutritional supplements and also diet. And the second bullet here, uric acid is also an antioxidant, which means if you have any oxidative inflammation in your body will usually increase uric acid because uric acid takes these inflammatory mediators and it can trap them and remove them. If it's too high, then uric acid itself becomes a problem. So we don't want laboratory tests too low. We don't want laboratory tests too high. We want them right in that sweet spot, which I call the functional spot or healthy spot. But if you do have an elevated uric acid, you may have gout, you may have pseudo gout, or you may not have gout, you have a high uric acid, but it's not high enough to put you in a diagnosis for gout. But we see that in many autoimmune diseases like multiple sclerosis or lupus-like conditions, mixed connective tissue diseases, all kinds of conditions like that. And a certain elevation is better. So for example, in multiple sclerosis, the higher normal your uric acid, the better your outcome of multiple sclerosis. So that's a sweet spot. We don't want uric acid's range, which is here to here. You're generally considered to be in the average because they create what's called a bell curve when they look at the entire population, where 95% of the population is in the center at the mean, and then 2.5% are at the low end, and 2.5% are at the high end, and you're supposed to be here. But this might be optimal for you, or this over here might be optimal for you. And that depends on the expertise and education of your provider to figure that out. But high uric acid might benefit from more folic acid, B12, antioxidants, and uric acid might be from renal failure or gout, as I mentioned, and there are other diseases that increase uric acid. So not all elevations of uric acid mean you need nutrition, or you might need nutrition, but it depends on the cause of the elevation of uric acid or the cause of the elevation of cholesterol or whatever the causes are that might elevate any lab tests. You need to treat those causes, have those causes in mind, and then look at the chemistry. I hope that was clear. I'm going to say it again in a single sentence. Not all laboratory tests that are abnormal have a nutritional meaning. And not all medical tests that are abnormal mean that you cannot benefit from nutrition. So nutrition is either a cause or an effect of disease. Either way, nutrition plays a role, as far as I'm concerned, in all human healing and health endeavors. The next bullet, number 4, is MCV. That stands for mean corpuscular volume. Don't get intimidated by the word. Mean is average, corpuscle is the cell, and volume is the size of the cell. So the mean corpuscular volume of a red blood cell might increase, like that. And that might mean a person has, again, high cholesterol, they may have cancer, they may be deficient in B6, B12, folic acid, vitamin C, E, or B1, also stomach acid, all from that one test, MCV. Now, when your traditional doctor reads an MCV value, if it's elevated, it would have to be seriously elevated, not just a little elevated, for them to even pay any attention to it. But any elevation is not okay. Why would it be okay for you to be out of the bell curve, okay, on the high end over here, when 95% of the population is all the way in the center? So it may be a value. These are the really, really important tests where you look at them and see what's on the high end of normal, what's on the low end of normal, and what's just out of the range. Sometimes doctors will tell you, well, this is the bell curve. Yeah, they'll say this is your range, let's say of MCV, mean corpuscular volume, and they'll say, well, you're just over here, so you're just a little out. That's a misinterpretation. You are a lot out compared to the mean. Okay, we have a range for a reason, so there's no little bit out. It's all important. Again, that's how the doctors read the tests. And then hormone levels. This is a very confusing area. I'm going to sum it up for you. Most hormone levels, whether they're in saliva, blood, or urine, are not very accurate in most cases. That's because you can have a hormone level swimming around in your blood, but these hormones have to get in touch with a receptor on a cell. So say this is a brain cell or a thyroid cell, what have you. So that hormone has to sit in a receptor. So let's say this hormone level is high. Your body says, oh, wow, look at that high level. I don't want to interpret that as high. I want to keep it balanced. So I'm going to change my receptor and not let all of that in. So it might be high in the blood, serum, or plasma, but your body will regulate its use until it can't. So basically, how do you find out if you need hormones? That's based on clinical decision-making and also the responses to at least detailed hormonal questionnaires that I would ask. So it's based upon symptoms and signs, not so much blood levels. And then liver enzymes. A liver enzyme test like LDH, for example, or ALT, these are different examples of liver tests. They are liver tests. But if those levels are high, you might have one form of hepatitis, maybe hepatitis A, B, or C, or that simply might mean that you need more lipoic acid, milk thistle, vitamin E, antioxidants, methionine, and acetylcysteine. So a liver test may have many nutritional considerations. So you don't have to only think about measuring the levels of the vitamins or minerals, but there are other non-vitamin mineral tests like cholesterol, like uric acid, like chloride, like MCV, like liver enzymes, right? They're not nutritional tests, they're not vitamins or mineral tests, but they do have potential vitamin, mineral, and other nutrient associations with them. And then calcium. Blood calcium has very little to do with calcium need because the body will keep the calcium very, very tight, even in severe problems with calcium, let's say deficiency. This will be one of the last places it shows. So blood calcium is known not to be a good indicator of calcium use. Maybe calcium excretion in the urine, that is a functional test and that does have value. And by the way, there are some cases where elevated calcium it certainly means something. It could be an indicator of hyperparathyroidism. The parathyroid glands, when they are excessively secreting parathyroid hormone, will generally increase the calcium level, and this can cause all sorts of hormonal issues. And glucose, blood sugar. So the first thing I'm going to say to you is going to confuse you, but it's the truth. Your blood sugar is affected by many other things other than the sugar you eat. I'll say it again. It's not only sugar that affects your blood sugar. Inflammation can cause blood sugar or glucose increases in your blood test. So can different toxins, which then might deposit themselves in your pancreas. And your pancreas is the organ that makes, the gland that makes insulin. And the beta cells of the pancreas may be damaged. So you can have pollutants and toxins that can cause high blood sugar. And people come to me and they say, Dr. Wald, I don't understand why I'm diabetic or why I'm on the borderline of diabetes when I don't eat sugar. I'm a vegan, for example. So any kind of inflammation, toxicity, and other health problems, many other health problems can cause sugar levels to rise, like certain tumors that have nothing to do with your sugar intake. Now, we're going to talk about a couple of these tests here under the slide, lab tests and nutritional considerations. To begin with, not all of these tests on this sheet are found on every kind of lab test. So if you think that your doctor is there every lab test, that's not true. Physicians generally do tests that are specific for their scope of practice, okay? And having said that, a standard blood test by your internist might include a CBC, a comprehensive metabolic panel. And then sometimes some doctors will measure vitamin D. It's kind of rare unless you ask for it. And then unless you have an obvious thyroid issue or ask for thyroid hormone testing, even the thyroid panel is not part of the standard panel that an internist might order. But then if your internist did order thyroid tests and they were abnormal, rather than just handling you there, which an internist certainly could do, let's say if the levels of thyroid hormone were low, they would prescribe, let's say, not Armour thyroid, but Synthroid to you, and that's that. But mostly doctors play this switch game where if you have abnormalities, let's say in this example with thyroid hormone, you would be immediately referred to an endocrinologist, a hormone specialist, who would read it the very same way as your internist. So this is what they call spreading liability around. It's a waste of time and money in a lot of cases, in my opinion. But having said that, I'm just trying to emphasize to you that different doctors do limitations. There's limitations on their blood panels. I tend to run voluptuous panels where I'm checking in many different specialties, you might say at once, because specialties are artificial separations. If you look at the body in terms of organ systems and then specialized tests, you miss the whole. I don't mean it to be, I don't mean that to sound philosophical, but it is. You will miss the entire person if you're viewing them as only organs and therefore viewing their tests as be-all and end-all tests when they are already limited in that particular profession. So let me just run through some of these tests for you that we haven't talked about, and then I might reiterate some of them later on given their importance. So total protein, that's a really important one. So the word total means the total of what? So we have total protein, and then there's the albumin and the globulin underneath the title total protein. If your total protein is low, what does that mean? It means that you may have a low total protein, albumin, or globulin, or both, which brings the total down. You want to know which one because these different proteins do different things. So if I check your total protein and it's low, I know that you are deficient in protein. That is something that might be able to be fixed through the diet, and sometimes maybe a protein powder might be best. But if you have a health problem like an autoimmune disease that's super using your protein, you need to know the specific biochemical features for that disease, and then you'll know how to apply protein or what types of protein, okay? But if your globulin is the type of protein that is causing the total protein to go down, I would know that that patient probably would have serious immune problems because globulin is an immune molecule. It's an immune compound needed for immunity. So we always want to pay attention to that low total protein. And homocysteine we're going to talk about soon, vitamin D. I'll mention to you that the optimal vitamin D level is 70. I didn't mention it, I don't believe, on the last slide where I talked about the healthy ranges versus the clinical ranges, but vitamin D should be a 70. Anywhere really between a 70 and 100. If it's over 100, most doctors will tell you that's abnormally elevated, and it is because the range is 100, but that may not mean it's toxic. If your liver enzymes are normal and you have, let's say, 100 on your vitamin D and your calcium is normal, then your body's handling that D just fine. But if your liver enzymes and or your calcium are elevated, that means you're taking too much, and then the doctor should stop the vitamin D. It might take a week, 2, 3, or possibly a month for those levels to come back to normal. And then when they do, you're started on vitamin D again, but at a lower dose. It's very important too, when you take nutrients to normalize or optimize different laboratory tests, you have to go back and check them to make sure that's what you've done. I had a patient sitting before me in this very office just last night who, the problem was they were taking the vitamin D in the right dose, but they were not given any instructions on when to retest. They just think because their doctor didn't say anything that if they're taking the supplement, it's just going to fix it, which obviously is just not true. Okay, so some of the tests here are some of the things that I prefer to do on my laboratory tests. So you can refer back to this slide later on, but for those of you that do not have the slide in front of you, we're talking about a CBC, a comprehensive metabolic panel with a hemoglobin A1C, which is a 2 to 3 month average of your blood sugar level. I also like homocysteine levels, vitamin D levels, and thyroid testing. All very, very important. Now, this is one of the more important slides on this whole presentation. So in the left column, it says normal or clinical ranges. And on the right side, it says healthy or functional ranges. Now let's go back to the normal side here for a second. It says here, and I've left the units out here, which means cholesterol is 0 to 200 micrograms per deciliter. I didn't put the micrograms per deciliter or the other units for these other tests because they'll just fill up space. So I just want you to know that was a purposeful deletion of that, as my note says at the bottom of this slide. So if cholesterol ranges are 0 to 200, now slide your eyes over to the right side, but healthy ranges are between 165 and 185. So that is a tighter, more optimally placed range based on science. But if your doctor says to you, well, your cholesterol is 190 or 195 or 199, they're going to tell you that's normal. But all of those values would be abnormal compared to healthy. The thing is this, for the most part, and this is a general statement, but it's mostly true, the normal ranges on the left side of this screen are based on, as I mentioned earlier, national averages of seemingly healthy people who have donated blood and where those ranges fall in. They're not based on studies of healthy individuals. So you must keep that in mind. So when traditional medicine determines these values, they also filter in that they require about 40% of loss of organ reserve before any of these tests become abnormal. So by the time you have a mild abnormality, that might mean you've lost 30 to 40% of your organ reserve. But because the healthy ranges on the right column here are tighter, they're going to pick up abnormalities much lower than 30%. So you see it coming sooner, right? If you can be more proactive and preemptive in your approach because you're seeing something move towards the abnormality, either too high or too low, but still in the normal range maybe, but not healthy compared to healthy people. Okay, so that will change the entire landscape and interpretation of your lab tests. Let's go back to the left column, or the normal or clinical ranges. Free T3 thyroid hormone. So T3 comes, free T3 is the usable thyroid hormone. It's one of the most important lab tests to include with a thyroid panel. The normal ranges are 130 to 400, but for healthy people, it's between 145 and 350. So you could be normal compared to the regular doctor's clinical interpretations, but if I compare you to the healthy ranges, you might actually be abnormal compared to those. And let's go to the next one, which is also a thyroid-related test, which is TSH. So TSH in the normal ranges are 0.4 to 4. Now, different labs have slightly different ranges, so you might look at a lab and they might say that the TSH range, or any of these ranges, or any other ranges, for TSH might be, let's say, 0.65 to 5.5. That may be their average. But move yourself over to the right side, and you'll see that I mistakenly put the TSH under the free T3. It's at the end there. So the TSH compared to healthy people should be, in my opinion, 0.5 to 1.18, compared to, again, on the left, 0.4 to 4. I'm saying 0.5 to 1.18. Studies have shown that you don't want it higher than 1.18, but that would not be considered an abnormality by other doctors because the 1.18 easily falls within the range of 0.4 to 4.0. Are you seeing now how healthy ranges might show abnormalities because it's picking up issues with your organs at a much earlier degree, which doesn't mean you don't have significant symptoms. But the point here is that you see things coming and you see things that other practitioners do not see because of what ranges they're considering. A few more examples. Thyroid peroxidase. Thyroid peroxidase is an enzyme, and the body can make antibodies against that enzyme called thyroid peroxidase antibodies, which is what this value here is of less than 35. So you can have number 1, 2, 3, 4, all the way up to 35 as a result, and your doctor will call that normal. But if you look over to the right, I consider anything higher than, and this should say 5, okay, not 0, 5 point, well, actually that is 5, excuse me. I didn't need the 0 before the 5. So if you have any antibodies at all, I'm considering that not okay, because that means that your immune system is starting, although maybe it's early in the process, it's starting to believe that your thyroid is foreign and it's making thyroid peroxidase antibodies to the enzyme in the thyroid that converts thyroid hormones. So you want to know if this process is happening as early as possible, because if it's a newer problem, then it's usually much easier to fix. Hope that makes sense. And then with gliadin antibodies, which have to do with gluten sensitivity and gluten sensitivity as far as celiac disease is concerned, or also it can be elevated in non-celiac gluten sensitivity. So I recognize that we do not want gliadin antibodies greater than a value of 5, but traditional clinical or normal ranges on the left say anything 10 or above is abnormal. I'm saying anything 5 or above is abnormal. Again, if I consider 5, I'm going to consider something abnormal long before your regular doctor would. And it is not supposed to be there. You're not supposed to have these antibodies at all. But there are these cutoffs in medicine because these cutoffs were established in part so that doctors know, okay, it's abnormal now. Not almost normal, but not on the way normal, but this is the range that medicine has taught me in medical school and my clinical experience that says I do not act until it's this level, which again, I think it defies common sense, but medicine is not very good at preventative therapies. And this is a way that medicine could transform, just like holistic providers like myself who look at these healthy ranges. So many healthcare providers across the country, a few hundred, use my blood detective technology. And those are the best of the best lab people that I know. Let me give you one more example here. Let's look at the last bullet where it talks about blood pH. So we mentioned blood pH a little bit earlier. The thing we want to know about blood pH is that the range in traditional medicine is about 7.35 to 7.45. This says 7.5 to 7.45, so that 0.5 should be 7.35. And then if you look over to the right column, I consider the optimal blood range to be about 7.5. So let me be clearer with these numbers. Regular average clinical pH of the blood, we're not talking saliva or urine, of the blood, is 7.4. That's the average. But I believe it should be 7.5, which is several times higher in order, more on the alkaline end of things. For every 0.1 abnormality from 7.4 is 10 times abnormal. So every 0.1 abnormality is 10 times abnormal. So if I'm saying that I want this at 7.5 and 7.4 is the average clinical and the healthy is 7.5, that's 10 times difference in pH. But I find that people feel much better and heal much better when they have a higher pH than average. There are exceptions to that rule because there are exceptions to every rule, which brings me to the next point. I wrote a 500-page textbook entitled Anti-Aging Laboratory Tests and Their Nutritional Meanings. And you can read about all of these and what they might mean. But when you put these tests together, along with, again, other information gathered from the patient, the nutritional advice given would be extremely different than if you learn about these tests as if they're individual tests. So that's why I rely on my blood detective software that can integrate the meanings of things in a way that would take me many, many, many hours, and it used to. And it's more accurate. So this is an important point that I'd like you all to be aware of. And I mentioned it earlier, but it's worth repeating. Not all laboratory abnormalities mean that there's a nutritional problem. So again, if you have a low level of vitamin C, it could be because you have, let's say, an adrenal gland disorder. And you would need to treat the adrenal gland disorder, which might involve giving vitamin C, almost certainly. But there may be much more behind that condition that needs to be treated. Otherwise, the body can hyperconsume nutrition. Now, in the reverse, not all laboratory abnormalities mean that there's a medical problem. So you might have a low level of, let's say, B6, and that might not lend itself to any problems for you. On the other hand, you might have a high level of B6 that might indicate that you have B6 toxicity, and it might have caused your neurological problems. That's actually a true and an accurate example. So all blood tests must be considered in context with the medical consultation, the health consultation and questionnaires, and the clinical decision-making of the provider. What is he or she bringing to the table in terms of the art and the science together? That you take the science and then there's an art in terms of how do you interpret that. And then the suggestions are given in that context. And then comparisons. I can't emphasize enough how important it is for laboratory comparisons. This is where most patients sort of drop out. They sometimes do not have enough patience or understanding to know that they need to recheck things. Let me give you a famous example. I see this all the time. So a patient may come to me and say, well, my doctor thinks I have an autoimmune condition, and he checked my ANA antibody, my anti-nuclear antibody, ANA. And then he did it again, or she did it again, and the lab test was now normal. So then they said not to worry about it. I said, well, why do they value the normal one over the abnormal one? Of course, the patient is like, I don't know. Well, there is no good reason. If you have an ANA that should be at this level here, and it's here, and the next time we check it, it's normal. What about the next time? It might be normal again. But if you do this 5-6 times, you might find that it's abnormal half of the time or more than half the time. So comparisons tell you what's actually happening. Labs at one period in time is like meeting someone for the first time and thinking that you know them. Maybe they had a bad day, or maybe they had a good day. So comparisons are important. So it's necessary to run comparative tests to learn about lab finding trends and progress or lack of progress to optimize whatever recommendations you are following or your patients are following, for those of you that are healthcare providers listening. So let me talk a little bit more about laboratory tests and some nutritional connections. So for those of you looking at the PowerPoint presentation, you see this very interesting looking slide. Forgive me one moment. We don't want to run out of power, do we? There we go. Okay, so we're looking at the slide here, and what it shows are these red blood cells, but you see these, they have spikes on them. They all have little spikes. And these types of cells mean that the cell is here, it's floating around in an environment, and in and of itself may be deficient in antioxidants, so it starts to oxidize, and it forms these spikes that come out of the surface. And when those go through a blood vessel, they scratch it, and they cause inflammation and hardness, and calcium comes in there and it takes up space, and there's atherosclerosis, or these organs microscopically rip through the rest of the circulatory system and in organs, causing all sorts of inflammatory mediated problems. But this is a test and a picture of a cell you have to see under the microscope to know that this is precisely happening. And then you'll see this other larger structure here, which looks like an elongated oval with these dark, well, it's purple in this picture, but these dark sort of areas or globules that stick together. Now, a normal neutrophilic white blood cell, which this is a neutrophil, should have about 5 of these inclusions in it. This one has more than 5, which means that this person might, among other problems, have deficiencies of B12, B6, folic acid, and other nutrients. So when you take those nutrients, you need to see that there are fewer of these lobes in the cell later to know you fixed the problem. if you're only looking at the blood levels could be fine and a person could still have these problems. This level outside of the cell may not have anything to do with what's in the cell. So we need to do cellular tests in many cases. And then I mentioned this test at the top here called Melanodialdehyde. That's abbreviated MDA, Melanodialdehyde. That's measured in the blood and the urine. And it's a test of oxidative inflammation. So if that test is elevated and you're taking all these antioxidants and you're doing juicing, which is loaded with antioxidants and all of that, if you're doing that, but your melanodialdehyde is still elevated, then you know you haven't done it right. So that's why blood tests are very important. You can't just rely, folks, on how you feel. Okay, quick commercial break. My name is Dr. Michael Wald. You're listening to Ask the Blood Detective. We're in session 2 of the 13-hour Master's Nutrition and Health course that I'm providing every Sunday at 1 o'clock on PRN. And also you can find these presentations up on my website at drmichaelwald.com under the blog section. And you can send your emails with questions, comments, and anything else to info@blooddetective.com. And you can call me if you'd like at 914-552-1442. Just use that phone number if you want to schedule the patient. All other communications through the website, contact us, or the email. So then look at our second bullet, vitamin C in the blood or the urine. Now think of it this way. Imagine yourself as a cartoon character and you're drinking vitamin C. So if you can see through you as a cartoon character, that level is going to go up and up and up as you're drinking. Blah, 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 blah. Now, if you're fully saturated, as you should be, Andre, do you like that movement and everything? Okay, fully saturated, then you will have vitamin C spilling over into your urine. So if I do not see vitamin C in your urine, it doesn't matter what your blood levels are. They could be high, very, 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 very high. But if they don't spill up, you are going to miss something. And you don't want 99% of the job done, right? Would you like 99% of your roof fixed? So you can see how you want to get the job done correctly, the right test for the right person at the right time, with the right comparisons, corrected the right way. And let me just go to the bottom bullet here, digestive enzymes. There are tests for measuring enzymes. You can measure lipase, amylase, and proteinaceous enzymes. The tests are of limited use, but a person might need enzymes as a very foundational part of the nutritional plan if they malabsorb. If you do all the appropriate laboratory tests that we're talking about and you're an instant blood detective overnight, you get it all right, but you do not have enough enzymes, what do you think is going to happen? That's right. You will not absorb things either fully or not at all. So tests of malabsorption are important. And I see that missing easily 95% of the time. I view patient labs. They've been to healthcare providers that have failed to do an absorption test, which again is at the foundation of everything you want to do that requires absorption. So it defies blood detective common sense, right? Let's move to the second slide, the next slide. And this is glucose, which is, you can measure glucose, of course, at any point in time, and that measures your glucose at the moment. But then there's hemoglobin A1C. I've mentioned this test a couple of times because it's a very, very important biomarker or predictor of many different diseases. So depending upon the cause or causes of an elevation of your blood sugar, and let's say your elevated hemoglobin A1C, which means over the course of the last 3 to 4 months, well, actually 2 to 3 months, your hemoglobin A1C on average has been too high. Now, if it is really from basic sugar problems, then the nutrients I've listed here on this page, including lipoic acid, which is a hypoglycemic agent, it will bring blood sugar down. It's very well studied in diabetic neuropathy, which is the nerve damage caused by blood sugar. B complex, needing more protein in the diet, the use of milk thistle, chromium, low glycemic foods, exercise, stress reduction, and more plants in your diet are just some examples of how you might approach an elevated hemoglobin A1C, which is simply elevated because of blood sugar. But if the hemoglobin A1C is elevated because, let's say, of inflammation of a specific type, then the nutrition must be focused on that to lower the hemoglobin A1C. So when someone says, well, this is the best product to lower hemoglobin A1C, you know that's ridiculous. So again, this is the kind of knowledge that should be starting to make sense with you now as a blood detective if you've been listening to many of these shows, which will allow you to make much better decision-making for your health and if you're a healthcare provider for the health of your patients. Chloride, almost no one talks about it, but if you have a low chloride on your blood test, you need chloride to make hydrochloric acid, which is stomach acid. So very important test. Checking that in the urine is usually a good test, or the blood. And I've named a few nutrients here that might help raise the chloride levels depending upon the cause of the low chloride. It might mean that someone's adrenal glands are blown out, which is why they have low chloride. They could be hyperhydrated, too much water, flushing out the chloride, making it low. Again, so if it's adrenal gland related, you might benefit from Asian ginseng or cordyceps mushrooms or rhodiola or adrenal glandular or an electrolyte supplement. So again, depending upon the cause or causes of your abnormal tests, depends on the approach or will dictate the approach. Same thing for magnesium. If you want to know how your magnesium levels were the last 2 or 3 days, you'll measure a plasma or serum level. If you want to know what your magnesium level is like over the past 2 to 3 months, you will measure red blood cell magnesium level. And if the person, for example, has muscle tension and tightness and or a diet that is not high in magnesium-rich foods like nuts, legumes, tofu seeds, whole grains, fatty fish, for example, bananas, leafy greens, then, and let's say you have a muscle twitch on the corner of your eye or something, or intestinal spasms, anything that twitches or spasms or stresses, you throw magnesium at it. And there are tests to figure out the optimal magnesium dose, but generally speaking, the optimal dose is the dose where you respond favorably. And that might require you to have levels of magnesium much higher than the regular clinical ranges, but maybe levels closest to the healthy ranges, which are much higher. This next slide here talks about total protein again. Remember, we talked about the total protein being composed of 2 types of subproteins, albumin and globulin. Now, albumin is a protein in the blood that carries different nutrients and medications. Sorry about that, folks. I had a little issue with this. Here we go. That was very strange. Okay. So albumin and globulin, as I mentioned, are 2 subproteins under the total protein measurement. And albumin carries nutrients and different medications and hormones throughout the blood. So if your albumin level is low, then you're going to have problems with hormone transference, nutritional delivery, and a whole host of other issues that involve albumin. Now, depending on the cause or causes of the total protein being low, and is it albumin, globulin, or both, and different conditions can cause that same abnormal test, you would apply the nutrition if it's applicable. But in general, if someone has total low protein, they may, number one, need more protein in the diet. But if they're over 50, they may need more protein and pancreatic enzymes, which have protein digesting enzymes in it to help you absorb better. And you might need oral immunoglobulins, or you might need stomach acid and pepsin. So stomach acid is essential for absorption of protein. So if you have low stomach acid, but you know you have total low protein, and let's say you're correct in your interpretation that you need more protein, if you don't give yourself the stomach acid, you won't properly absorb the protein, or whatever, from whatever source, whether it's a shake or pills or whether it's food. Homocysteine, another very popular biomarker test. Elevated homocysteine is a bad thing. Homocysteine should not be greater than a value of 7, but most labs consider 10 and higher abnormal. And that value has been increasing over the years, where much lower values used to be considered abnormal. There's no good reason for that. So a 6 or a 7 is what I want to see on homocysteine based on studies that are called meta-analyses. Those are studies that looked at the very best properly performed studies of homocysteine and determined that 7 is the magic number. So if you are, if you're an 8, I would consider that abnormal. But you could be an 8, 9, or a 10, and your doctors are going to say you're normal, and they will leave that. But that is wrong. Now, homocysteine could be elevated. And by the way, for those of you who don't know what homocysteine is, it is a toxic amino acid. Now, the thing about homocysteine being elevated is that any number of nutrients might help lower it, including folic acid, B6, B12, stomach acid, choline, gentian root, and some others, along with different foods like broccoli, Brussels sprouts, leafy greens, etc. So Depending upon the condition that the high homocysteine is in, you treat that person's chemistry. What I'm giving you here is very generalized information. Vitamin D3. So with vitamin D3, we know that the test is important, and we wanted to use the test which is called 125 D3. This says D5, that's a typo. Please change that to D3. And we want that vitamin D to be between a 70 and 100. If it's low, then generally speaking, the person takes 50,000 units of vitamin D once a week for 8 weeks, and then they retest the blood, and then they take a lower dose of vitamin D to optimize the value. Liver function tests I mentioned earlier, I won't go into them much more now, other than to say that depending upon the cause of the liver function test, again, it could be a virally induced elevation like hepatitis A, B, C. You might have toxic vitamins. You might have hepatitis of the liver from vitamin overdose, or heavy metals, or cancer, any number of things. So again, the suggestions here for the nutrition, some of them are right no matter what the causes are, like silymarin and antioxidants and NAC. But you do want to know what the cause or causes are of the elevation. Same thing with white blood cells, either an increase or a decrease might both mean that you need more proteins and vitamin C and zinc, but it also might mean that you malabsorb, or you might need thymus support, which helps to elevate the white blood cell count to normal. So once again, depending on the combination of different lab tests, your nutrition will be very different. So if we look at white blood cells and total protein and homocysteine, for example, and you look at each of them, each one will have their own nutritional issues. But when you consider them together, a lot of things cancel out and things become very concise about, well, here's what you actually need when you see those 3 things together or those 30 tests together. So you want to be careful interpreting any one test, folks. Many of you are going to make that mistake, even though I'm telling you. You say, my homocysteine is high, what do I do? Well, I need to see the rest of your tests, how they all relate, because that changes what you might need to do. The same thing for low red blood cells. You might have iron deficiency causing low red blood cells, which is iron anemia, or you might have protein deficiency, or you might have both protein deficiency and iron. You might also have B12 and folic acid deficiencies. So again, or you might have a process going on, maybe an inflammatory or autoimmune or cancerous process in your bone marrow where the red blood cells are made. And clearly these nutrients would be missing the point if you didn't actually know the cause or causes of the low red blood cells. So you can focus the nutrition on those particular cells. The same thing with uric acid I mentioned earlier. If your uric acid is low, that's going to be a problem. Your body won't handle oxidative stress as well. And if your uric acid is too high, well, that's too much acid, and that's going to rip apart your blood vessels, and it's going to cause a lot of pain and kidney issues and heart issues. So it's important to know what's the cause of high, what's the cause or causes of low, then you supplement appropriately. Same thing for the size of the red blood cells. I mentioned mean corpuscular volume earlier, or the MCV. It could be large, which might mean it'd be 6B12 folic acid deficiency. It might be small, which means there might be an iron deficiency or bone marrow suppression, something like that. So once again, you got to know how these tests compare to one another. The same thing for blood fats like cholesterol. You want to know what the lipid values are. Lipids are the fats compared to other tests. Food allergies, these tests are very inaccurate. All I can say is that many people get tests and they have many false positives on food allergies because of inflammation causing leaky gut, foods getting through the leaky gut, antibodies forming against practically everything you eat. So you get a test back which shows all these zillions of food allergies. And then when you reduce the inflammation, that might go down to 1 or none. So we always need to compare food allergy testing in the context with other considerations to know how accurate or inaccurate those laboratory tests might be. Same thing for gluten, as I said earlier, with the Gliadin antibodies. So you might want to look back upon that, that Gliadin chart. There's also a few other tests for gluten, like transglutaminase and reticulin antibodies. The point of this whole conversation here is you don't want any antibodies. Your doctor might say, well, there are antibodies, yes, but they're low, so I'm not concerned. I would disagree with that. You don't want any antibodies. There's an early process starting, but doctors wait until the end of the process. We want to intervene in the early dis-ease if we can, or even prevention. That would be wonderful. Same thing with thyroid. You have to lose 40% of your thyroid function before your tests show anything. So even a little bit out is significant because you've already lost 40%. So I have tighter, different ranges for thyroid to find earlier issues with that thyroid. So depending on the cause or causes of your low or your elevated thyroid hormones would determine how you would treat that nutritionally. So for example, if you had high thyroid hormone, I might actually want you to have certain goitrogenic foods in your diet, like broccoli, and cauliflower, let's say. They help block thyroid hormone. But if you have low thyroid, we don't want to block your thyroid anymore. It's already low. So what happens there, though, is if you take the goitrogens, those foods, what they will do is they may block your thyroid hormone even more and make your hypothyroid condition even worse. C-reactive protein is another inflammatory mediator. It's sort of like ESR, which I have not mentioned yet, but ESR and CRP are inflammatory tests. You want the CRP high specificity test because it's more specific than just CRP. So again, depending on the cause or cause of inflammation, you would point your nutrients specific for that. But in general, common nutritional issues that I find with people with elevations of CRP include an increased need for lipoic acid, which is a B vitamin, fiber, echinacea, DHEA, vitamin E, for example. And again, you would continue to supplement until these tests are normal. We already talked about hormone testing and the inaccuracies around that, so I'm not going to mention that anymore right now. And I just wanted to mention two blood types. Blood typing is almost useless. There's no scientific value to it. You might have heard perhaps in COVID, for example, people with type A's do better than another type. This is really not very strongly validated at this point. And I've had the opportunity to treat hundreds of patients over the last 30 years of my career and found that even those that lose weight with a blood type diet, the rest of their labs look terrible because of the diet, depending on that diet. So I do not use this, although I have given you in the PowerPoint presentation here some of the associations, things that you shouldn't eat and things that you should eat depending on your blood type, just to be thorough. But again, I wanted to be clear that I do not value this test at all. So some key points: no single blood test can determine your dietary needs for weight loss or health in general or whatever the problem is. Testing multiple body systems at a time is far more accurate than specialists just using their specialized tests. So blood detectives will always look at a conglomeration of tests in context with the conversation with the patient, their genetics, their lifestyle habits, and other important considerations. So testing, clinical experience, genetic potential, toxicities, medications, health goals, all are considered to create an overall health plan. So putting it all together involves perhaps a nutritional approach, looking at one's eating habits. What are you eating? When are you eating it? How are you eating it? Why are you eating it? What are your goals? What do you want to do? And how much time do you want to do that in? If someone says, I want to be healthy in 6 months as opposed to 2 years, we're going to pace ourselves quite differently. And we want to look at blood tests and other forms of test comparisons when making adjustments. And we always want to consider comparing people not just to the clinical values, but to the healthy ranges as well. And being mindful of those tighter, healthier numbers, because they will reveal a completely different story about the person. So adjustments are made based upon results, which will change care over time. And hopefully all the tests are done by a qualified physician or doctor with the proper qualifications who knows how to interpret laboratory work. Woo, that was a lot of lab testing. Again, you can watch this again or you can listen to it. I hope you found it of value. Please join me for the next session. When you look on PRN, you'll see what the next topics are as well. The topics might change, but essentially they should stick to the schedule that is up on PRN. If you also want that scheduled, you can email me at info@blooddetective.com, info@blooddetective.com. You can call me to arrange a consultation at 914-552-1442 and check out all my free content on my website at drmichaelwald.com. And just for listening, if you contact me and you do want to schedule an appointment, I will speak with you for 15 minutes for no cost at all to see if I'm the best provider for you and to get clear about your health goals and all that good stuff. So thanks everyone for joining me. I will speak with you soon. Bye-bye.